Hi, my name is Dr. Andrew White. I own Higher Health Chiropractic in Holland, and I'm going to be sending you some videos over the next couple of weeks. They're going to be talking about what causes your nerve pain, first of all. Then we're going to talk about how the adjustments specifically are helping with it. Then we're going to wrap up with what you can do at home to actually help get the best results possible in the investment you're making in yourself. So first of all, what causes nerve pain? So this is probably one of the most common things we see in our office. A lot of patients, whether they know it right just off the get-go, the chiropractors can help with it, or they've been through a handful of providers before they ended up to us. They'll find out very quickly when we do those assessments that we focus on the nervous system, right? So we use those technologies at your first appointment, which allowed us to see exactly where there's inflammation going on in the spine and how there was tension or weakness in the muscles, and just figure out exactly what's going on with structure. We also probably took some x-rays for you that allowed us to see the structure of the spine, which gets into really what's going on with why you're having the nerve pain. One of the most common misconceptions that we often hear from patients is they think that arthritis, or in this case disc disease or degenerative disc disease in the spine, is simply an age issue, right? They'll say, oh yeah, I'm just getting older, that's why I'm having it. But what they don't think about is that if you're having disc disease, let's say at C5, which is creating nerve pain down in your arm or your hand right now, that the discs above and below are perfectly fine, right? You're not having the same issues in those areas, and that's because, again, this happens through structural change. So when you have a structural change, so if it's in the neck, again, you lose the curves in the hips, there's unleveling that creates stress points biomechanically in the spine. Eventually those discs begin to fail. So again, what happens is that cartilage or the fibers around the outside begin to fail. That lets the disc begin to collapse, which becomes unstable. That instability creates inflammation, which then creates the pain in the nerve. Your body will respond by creating extra bone or bone spurs to try to mitigate that. And it can get really out of control really quickly. So again, that's one of the biggest things that creates this problem is, again, this structural change. So what we're going to talk about next week is specifically how do we really get ahead of this, right? If we know that the issue is just irritation on the nerve, how do we use adjustments to actually take away that irritation, prevent it from coming back, and just prevent you from needing a surgery? I'm sure you've probably heard this story before, but if you haven't, I became a chiropractor because of my mom. My mom had a disc issue, just like you do. My mom had nerve pain, just like you do. But she, unfortunately, though, went to her medical doctor first, who told her the only option was a back surgery or a spinal fusion. And after that surgery, what she wasn't told was that 2/3 of patients who need a spinal fusion surgery or get one will need a second within 6 years. So she got a surgery, ended up getting a second one about 3 years later because she was still having so much pain, and then even after that still had pain. So then the only other option they gave her were opiates or painkillers. And she actually became an addict. And so that whole process is why I went into the field I did, and why I'm so passionate about helping you or anyone understand what is degenerative disc disease, how is it affecting your spine, what are your options if you are having it. And I totally empathize with the pain you're going through right now. I literally grew up with it with my mom. I know it can be debilitating, and I'm sorry you're going through it, but I am happy that you are watching this, because that means that you're a patient in my office, which means that you're taking steps to get ahead of it right now so you don't end up like my mom, but in a much better position. And I'm excited for you just to get those results. And next week, again, we're going to talk about exactly how adjustments are going to help you reach that.